Hello, we are the Ebola monsters, unfolding the story of Ebola in the media. This video was proudly produced by Kelsey Stramberg, Allison Dunlop, Stephanie Goodell, Brianna Kaonim, and Jaron Winky. Let's get started. You may be asking yourself, what is Ebola? I'm sure you heard about Ebola in the news a couple years back. According to the Center for Disease Control, or otherwise known as the CDC, Ebola is a viral disease, also known as EVD, and is a rare and deadly viral illness that is reportable to the National Notifiable Disease Surveillance System, NNDSS, in all U.S. states and territories. The Center for Disease Control also states that every recognition of EVD is critical for infection control. Healthcare providers should be alert for and evaluate any patients suspected of having EVD. This is because Ebola spreads very fast, and many individuals do not realize they're carrying this viral disease with them. The first outbreaks of Ebola originated from the African countries of Nigeria, South Sudan, and Zaire in 1976. According to the World Health Organization, WHO. The first outbreak of Ebola Sudan, infected over 284 people, with a mortality rate of 53%. A few months later, the second Ebola virus emerged from Zaire, known as Ebola Zaire, EBOZ, with the highest mortality rate of any of the Ebola viruses, 88%, infected 318 people. Despite the tremendous effort of experienced and dedicated researchers, Ebola's natural reservoir was never identified. The virus is transferred directly through bodily fluids such as mucus, feces, vomit, semen, breast milk, tears, nasal blood, saliva, and even open skin wounds. This means that the virus spreads very easily and is considered contagious. In November 2014, Ebola was reported to have infected over 15,000 people and took the life of over 5,000 people in the previously mentioned Western African countries, according to the World Health Organization. Within the United States, 10 people were treated and 8 survived. The cost to be treated for Ebola per day in the United States is $25,000 to $50,000. This research proves that treating Ebola patients is very costly, increasing the cost depending on how many patients are being treated and for how long. According to the United Nations from the World Bank, Sub-Saharan Africa's economy was expected to incur losses of around $3 to $4 billion, and short-term gross domestic product (GDP) growth in the 3 most affected countries was expected to decrease. United Nations Children's Fund, otherwise known as UNICEF, estimated that at least 7,500 children had lost 1 or 2 parents, and 5 million children remain out of school. This means that due to Ebola, many youth do not receive proper education in Sub-Saharan Africa. Also, Africa has spent millions of dollars to help this widespread disease, but the individuals in these areas are still contracting this deadly disease. According to the Centers for Disease Control, the CDC took even more aggressive approaches towards the Ebola scare by requiring mandatory quarantine for returning medical personnel in some states. Although opponents argued by saying these steps taken by the CDC actually increased the amount of unnecessary panic and fear within the public. Opponents felt that the Center for Disease Control took over the news increasing fear among populations throughout multiple countries globally instead of nationally. After the biggest recorded Ebola outbreak back in 2014 to 2015, suspicion and fear of potential spread to the United States increased, along with information spread through media. It is known that media can influence one's perceptions about certain topics. In this case, the terrifying outbreak alarmed everyone around the world. Even though it is very helpful that media shares information whenever something is happening around the world regarding topics that have a massive impact in society, information shared and provided to the audience can be eye-opening and compelling, helping to keep cities together and informed. But media can also be very misleading in a way that the information creates danger and aggravates public safety. Individual knowledge and self-engagement of each community member is a key factor towards trying to minimize the spread of Ebola. For one, individuals must be aware of how to properly keep themselves healthy and hygienic enough in order to get their immune systems at their best, and in turn refrain from possibly receiving the virus or at least be able to fight it off. This means that someone would have enough knowledge on something as simple as covering one's mouth when one would cough or sneeze, since Ebola is transmitted through personal contact with bodily fluids. Although there are public health measures in place that try to enforce these actions, there cannot be an overall assumption or conclusion that each person will follow such measures. Moreover, if an individual became infected with the Ebola virus, one must be knowledgeable enough to report the symptoms and seek medical review. If failure to do so, the virus can be very well spread unknowingly throughout the public, and in the end, health education is key when trying to combat the issue of Ebola. With proper education, the public will know more about disease globally instead of just about epidemics and pandemics. This means that individuals will have the knowledge on how to protect themselves and will not panic from mass news reports. Interpersonally, one must be educated on the disease and be aware of outbreaks. From previous Ebola cases, the media frightened human populations globally, causing unwanted stress and fear. From the research concluded, the media did affect how people perceived Ebola.